This video is about what psychiatry does as opposed to what they should do. I'm going to start off by saying that I don't agree with the processes and the procedures in society for the quote-unquote mentally ill. Recently in the news, there was another mentally ill man, besides Ezell Ford. I forgot where they said it was from, but there was a body cam, and the guy basically lunged at the police, a couple police officers with a screwdriver, and they proceeded to shoot him several times. And some of you will automatically jump to the conclusion that, if this guy had been on his medication, would he have still done that? Which is a fairly reasonable question. But the other side of the coin is, would a regular person who's angry have done that? Okay? And of course, we see many incidences, people who aren't considered mentally ill do stupid things. They're angry. They get carried away in anger. So, going back to the deeper philosophical question, what should we do with the mentally ill who are quote-unquote mentally ill in a way that could possibly be harmful to society and could possibly be harmful to themselves? And should we drug them in a way that is going to be harmful to them by the side effects, obviously? Should we force them to take medication? And if we should, where should we draw the line? Well, fortunately, I have a lot of insight into this that most people don't have, because I've seen how I've been treated, and I've done a lot of research on this, and I've seen how other people are treated or mistreated, depending on how you look at it. And I don't agree with it. One answer could possibly be, well, you get a bunch of psychiatrists, bunch of mental health experts' opinions, and you look at the bigger picture. In theory, this seems all good and fine, but as it works out, is all the psychiatrists are trained the same way. They ask the same set of questions, and they look at your previous diagnosis, and if they don't have the paperwork, they ask you, have you ever been diagnosed before? And almost always patients will tell them the truth. They'll say, well, my last psychiatrist said this, and they'll write that down, and they'll look at everything, and they'll look at the previous diagnosis, and they'll say, you know what? It's safe to put that. So they'll second that. They'll third that. As you go through the system, say you're going through the system 15 times. All 15 times you'll have a diagnosis which is either the same or it's something that you could say, well, that guy had it wrong. It's really this because it's similar to this diagnosis. Okay? So when you go to, say, a hearing for, your discharge, they'll look at that and they'll say, well, all these people said this, therefore, we have to treat this person this way. And that doesn't work. Say you're an angry person. I'm going to throw out a scenario, Say you're an angry person who's a political activist, okay? Even if they're not targeting you on purpose. Most of the time, you're being targeted on purpose. Make no mistake. The government sees how the system works. It's designed for a reason that way so they could use it against political dissidents. Okay? But say that they're not even trying to do it that way. Say you're just angry and you argue with your wife or your parents, and so they call the cops, and they call the cops more than once because they know in their head that's now a weapon. As soon as they do it the first time and you get taken away, they know that, hey, I can call the cops, they will take you away. Okay? And many times they'll start looking at you a certain way. Your wife will look at you like, oh, really? Don't you know I can call the cops? Same thing with their parents. They'll feel powerful and be like, don't you know we can call the cops and get you taken away to the situation you don't want to be in? And after you've been to the psych ward one time, they're not even going to consider. Automatically, you're transferred to a more permanent psychiatric institution. So, the system is broken. It doesn't allow for objective, deductive reasoning. It doesn't allow for objective, critical thinking. It is pretty much like a bunch of people stamp, bipolar, you get sent to the next one, stamp, bipolar, you get sent to the next one, stamp. They may as well have stamps, one for bipolar, one for depression, one for, schizoaffective, and stamp, You know, they see paperwork, you know, okay, ask you a few irrelevant questions, stamp, on to the next one, okay? They get in the routine. You know, he's been here for about 2 weeks. You know, is he taking his medicine? Has he been acting up? Has he been threatening anybody? No. Okay, discharge, you know. Has he been taking his medicine? Oh, he hasn't been taking his medicine? He's been arguing with the system? Well, let's keep him longer. Because now, quote unquote, he's a liability. So, now that I've painted a pretty clear picture about what is wrong with the system, let's look at logical solutions. Okay, first of all, you know, okay, I'll put it like this. There should be a very basic test that somebody at a first grade level could pass, okay? If you can pass a very basic test of, you know, what do you want to eat for dinner, you know, what's your favorite color, you know, what's 6 times 6, you know, very basic questions, okay, just to show that you have you're not completely wacko, you know, and you're not out of any, and you can do it in a reasonable amount of time, okay, and you sign something after you get your results. You know, you sign a piece of paper that says, yes, that was my results. That's really what I took the test, to make sure that they can't use this test as a way to, you know, get you on meds when you didn't really take the test. You know, and you understand ahead of time. When the cop comes to get you, they say, you're going to have to sign paperwork. They make it clear to you at several points. So there's no room for, no margin of error for them to trick you. You take the test. As soon as you pass that test, forced medication out of the question. Boom. No, out of the question. If you have a certain basic understanding of life, and whether or not you agree with the questions that are being asked, you understand the answers they want you to give them, then you should be in charge of your own destiny, period. No questions asked. It's a matter of free will. It's a matter of basic human rights and dignity at that point. Forced medication out of the question. Of course, someone such as myself with a college degree or someone with a high school diploma, you know, it's ridiculous to force medicate someone like that. They have a higher understanding. So anyway, secondly, I don't believe in long hospital stays, you know, because that is basically the same as forced medication. If you understand that, hey, if I'm going to get out quicker, I got to take the medication, I got to go through the program, I got to act nice to everybody. You're basically forcing people to behave a certain way, and you're basically forcing them to be medicated because they know, you know, that they're going to have a deductible to pay when all is said and done. And that deductible depends on how long they've been there. So you're holding their finances against them. And most people aren't rich. Most people don't, you know, are forced to care about money, you know. And even if they aren't, there's still so many other reasons why I don't agree with that. So I don't agree with the prolonged hospital stay, okay? 24 hours, tops. No, I don't believe in a 48 or 72-hour hold. 24 hours, tops, okay? And really, you can be out in several hours if you show that you have, you know, control, okay? And also, the procedure for, you know, when the cops come, I don't care if you've been to the psych ward 10 fucking times, okay? Unless you have a history of fucking wilding out and, you know, trying to kill people, there shouldn't be any hold at all. You know, any mandatory hold. You know, there should be a maximum hold. 24 hours. Gone. You understand? At that point, you can either go home or you can go somewhere else. Okay? And if the people you live with, you know, there's like some rule that, you know, if you've been living in a place for like over a year or something, whatever, they have to give you a 30-day notice or something like that, should still apply. Okay? The people you live with, you know, after you've been discharged because you showed restraint, you know, let's say motherfucker goes home and kills their parents or something, right? Motherfucking regular people do that anyway, okay? There should be no extra rules given over something we don't understand in the first place. Now, I'm almost out of time, you know. I think medication should be, especially under these circumstances, should be almost, it's an extreme last resort. Extreme last resort. You understand me? Even if the pharmaceutical companies have to be compensated for their research, not their marketing, by the government to keep them going with the medication. Also, fuck, I'm out of fucking time. There's something else I want to say, and I forgot. I'm going to have to make another video. Thank you.